This is often needed if an implant is to be placed at a later date following the removal of a tooth. The procedure could usually be done with local anesthesia, Novocaine. With a scalpel blade, an incision is made in the gum margin circumferentially around the tooth. The tooth is removed with minimum trauma, ensuring that all the walls of the socket are intact. The socket is cleaned of any debris or inflamed tissue which is typically present. The socket is then filled with the bone graft material, either bone particles or plug. This is obtained from an accredited bone bank. A membrane may also be placed over the grafted material. Sutures are then placed across the socket. The site will not be ready for implant placement until approximately 6 months.